And joining us now is OCTA Research Fellow Guido David. Good morning, Professor David. Thanks for joining us here on New Day and Happy New Year. But what a new year it is. How many cases are we expecting this week?
Well, Happy New Year, Ria. And yeah, it is kind of a surprising start for the year. We're actually expecting a high number of cases. It will likely dip possibly today and maybe even tomorrow. We might see slightly lower numbers compared to yesterday. I think we're projecting about 3,000 to 3,500 new cases today. Possibly same range or similar range tomorrow, but towards the end of the week, we might see higher numbers again because there's a continued increase in the positivity rate. So it's not yet clear, but we might already breach the previous high numbers of cases sometime towards the end of the week or maybe even next week.
Professor, you mentioned the reproduction rate. What reproduction rate are we looking at right now, and what do we expect it to be again in the coming days?
Yeah, right now it's already at 4.78, Ria, and this is really high. And to put it in context, in the previous surge, during the Delta surge last July to October, the reproduction number did not even reach or exceed 2. And here we're already at 4.78. I mean, even the March surge did not, well, it went as high as around 2.1. So this is a really high rate of infection that we're seeing in Metro Manila area.
So do you think we will eventually see numbers even higher than the Delta surge?
That is a definite possibility that we will see higher numbers compared to the Delta surge. So we might even exceed 10,000 cases in Metro Manila. But again, there's some hope that the current restrictions will slow down the rate of transmission and at least maybe decrease the number of at least the highest number of cases will be much lower due to the alert level 3. But yeah, we have to see how it plays out this time.
All right, given the fact that we haven't ever really seen cases increase this sharply, do you think this surge in cases can be mainly attributed to the Omicron variant?
I believe so, that there's a high likelihood of the Omicron variant driving this surge in cases.
All right. And based on your observation, Professor, is the rate of transmission now faster compared to when we were experiencing the surge driven by Delta, especially at this, let's call it early stage?
Yeah, it's definitely faster. During the Delta surge, it never reached past 2. So that means one person was infecting about 2 other people. But this time it's almost at 5. So it's at 4.78. So one person is infecting 5 other people on average. This is similar to the rate of infection that we saw in South Africa during the recent surge that they had with the Omicron virus.
All right. In South Africa now, they're seeing, their numbers steadying and actually decreasing. Is that something we can expect for the Philippines, that hopefully it'll be a quick surge?
Yeah, that is a ray of hope. If we compare the situation to South Africa, they had a massive surge towards the end of November, but now they're already on a downward trend, and it's a rapid decreasing trend. So their surge basically lasted just 1 month. So there is hope that this may just come quickly, but it may end quickly as well. I mean, it cannot be guaranteed at this time because each country's experience is unique due to a confluence of factors, but we can at least hope for the best, that this will just come and go like what happened in South Africa.
Right. Do you think our vaccination rate will allow for that, Professor?
Definitely, Ria, because we have a high level of vaccination. I mean, all over the country, we're already at 50 million people fully vaccinated, and in Metro Manila, I think it's 70 or 80%, 70 to 80% fully vaccinated. I mean, considering the entire population. So most adults are already vaccinated in Metro Manila, and that will help curb the increase. And in addition, that will help decrease the number of hospitalizations, which is what we're watching right now. If we don't get a high number of hospital beds occupied, then we may not need to have a strict lockdown like in previous surges. We can probably go through this wave without having to have a strict lockdown.
Right. It's perfect that you mentioned that because I did want to talk about the severity of Omicron. Is there more information available now as to, the types of symptoms and severity of symptoms that a patient would have?
Well, basically, they're saying in other countries that these are, most symptoms are cold-like symptoms. That means, there could be fever, cough, runny nose, sore throat, headache. So these are the types of, this is the type of presentation that we're seeing with the Omicron. But the rate of severity is much, much lower. In fact, the number of hospitalizations due to Omicron in South Africa and even in the UK is much lower. And the number of deaths that they're seeing is much lower. We're hoping that because of the high level of vaccinations in the NCR, this is what's going to happen, that we won't really feel a dramatic impact in terms of deaths and hospitalizations. There will be just a high number of cases, but we'll be able to manage it.
Right. Lastly, Professor, for you, what do you think is the worst case scenario? How high could the numbers go? And do you see us breaching our record?
I think it's very possible that we'll breach our record. Our record in Metro Manila is about 9,000 cases in one day. I could definitely see us breaching that. But again, to put it in context, if we breach that record, if we reach 10,000 or maybe even more, we might even reach 15,000 cases or so in Metro Manila. But even if we reach those levels, which is not certain at this time, if we have again a low number of hospitalizations, it will not really impact our healthcare system that much, and we can in a way live with this. But again, we encourage the citizens, our residents, to practice minimum public health standards and reduce unnecessary travel at this time, so as to avoid the transmission of the virus.
Right. Some very simple but very important reminders there. Thank you, as always, OCTA Research Fellow Guido David.